Hi, I'm James Rippey, one of the consultants here at Charlie's. This video is just looking at some of the aspects of ultrasound guided vascular access that make all the difference. How to hold the probe, how to find the needle, and how to angle the probe to optimize your image. Enjoy. In the ideal world, when you do ultrasound guided vascular access, you've got time and space and everything set up beautifully like this. I like to have the ultrasound machine at one end, everything in a line, the patient's vein coming this way, my ultrasound probe and my vision all in a row to make it easy. I also like to have everything within easy reach. So I have two sterile fields. I have the pale blue sheet from the dressing pack, and on that I have my cannula, my J-loop and my dressing and some gel. And then the other blue square, which is the container that the ultrasound probe cover comes in, and that I put on the patient, and so I can leave the probe resting like that without a worry that it's going to fall off and it remains sterile there. So I've got these two areas ready to go. I also like to be sat, ideally, and then when I'm doing the procedure, I can rest my elbow or my wrist on the bed or the patient to make sure it's nice and stable. When I've done the procedure and I've got the line in, I can put the ultrasound probe down, press on the vein and get my J-loop without leaking any blood. I attach my J-loop and then we can clean and do the dressing. I'm now going to show you how to do this on a real patient. So this is how I hold the ultrasound probe. My ring and little fingers are used to sit on the patient and stabilize the probe. And that way I can control the sliding of the probe and make sure when I'm looking at the screen, the probe is held exactly still. So my ring and little fingers are against the patient, stabilizing, stopping any nervous tremor, and ensuring that the probe stays absolutely still when touching the patient. So that's those two fingers. These three fingers are around the probe, and they're to control how hard I press the probe and also the angle of the probe. Now, if you hold the probe like this, which is what novices tend to do, it's very easy to accidentally slide one way or the other, or to press harder than you want, and controlling things like angle is more difficult. So I hold it like this, and when I'm doing vascular access, one of the key things is rather than pushing with the probe, you almost want to lift with the probe to enable a vein to dilate. And so here you can see in the middle of my screen, I've got a nice dilated vein, and I'm pressing very, very little on the patient at all. In fact, I'm almost lifting with these two fingers, I'm lifting the probe to allow that vein to get big. The automatic looking with gentle probe pressure collapses the vein entirely, but lifting and then you can see it. So the three fingers that are holding the probe lift it, and they can also angle it towards the needle to improve needle visualization. So just to go through that again, these two fingers are to stabilize and to ensure that the probe is still on the patient's skin. These three fingers, my thumb, pointer, and middle finger, control probe pressure and actually reverse the pressure by lifting the probe and control the angle with which the probe approaches the needle. So this is why the angle of the probe compared to the needle is so important. We can see here the probe is perpendicular to the surface of the skin, but not perpendicular to the needle. And we can see on this well-used Phantom, we're not seeing the needle at all, unless I jiggle it, and now we can see some movement where the needle is in the middle of the screen there. But to improve the visualization of the needle, I need to angle the probe so the angle between the ultrasound beam and the needle is 90 degrees. And then the needle becomes much, much brighter as we reach that 90 degrees. And we can see reverberation happening there. So as we do ultrasound guided peripheral vascular access, we try and hold the probe so it's perpendicular to the needle. So there we are, perpendicular to the needle. Then that reverberation gets less and less as the angle changes until it becomes almost invisible and just a shadow
below the needle, which you can then only see when you move the needle and you see the tissue moving. So that's why I angle the probe towards the needle when I'm doing vascular access. So now I've got my target vessel in the middle of the screen. I'm holding the probe in the right way, and I pop my needle in the skin, the ultrasound down, come and find the tip, which is just there, angle towards me to make it nice and bright, slide it away, and approach that vein. Moving slowly with the probe, and then advancing the cannula off. We have success.
So those are a couple of tips on ultrasound guided vascular access. We'll be doing more videos soon.